Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir-Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin.
Imam Deen Mohammed II, the son of Imam Deen Mohammed, a leader of the Muslim community of over 40 plus years now. Um, my father, ministry of Imam W.D. Muhammad, and this is our first Sunday program. Every first Sunday of the month, we've continued in the tradition that Imam started close to 20, maybe 20 plus years ago with this program. It's a community program which we enjoy, and we welcome the viewers, the regular viewers, and those that may be watching for the first time. We hope you enjoy our program today. But I believe we have some of the Muslim Health Consortium on with us today, and if they're available for some to make some comments to keep us updated during this pandemic. You know, this is a very unique time for us as citizens of the world. The world has never seen such a I guess a one world community, all in one living room, like one big family, all together experiencing the same things and affected by all the same things. So it's very much necessary for us to behave like a community and like a family. And we appreciate the input and the expertise that we get each month. We've been blessed to get so far each month from the Muslim Health Consortium.
Bismillahirrahmanirrahim. We'd like to thank Mosque and Imam Deen Mohammed II for this opportunity to be able to give the community this update from the Muslim Health Consortium. We will strive to keep it brief. We have some good news, alhamdulillah. The good news is that things look better at this point than they did before. As you may have heard from the news reports, the COVID cases are down, the number of hospitalizations are down. There are no real hotspots in the country at this time. The death rates at the highest was 4,300 deaths per day, and that's now down to 2,000 deaths per day, which is still an awful lot, but it's half of what it was before, alhamdulillah. We also note that the vaccinations are up. They're at 2 million per day, which is a sizable number. And at this clip, we're running ahead of the goal that was set by the Biden-Harris administration of 100 million vaccinations in the first 100 days. So that, alhamdulillah, looks good. Also, there is a release of the new vaccine, the J&J Johnson & Johnson vaccine, which Brother Ron will give you more information about. But before going much further, we'd like to put that good news in context. It means that we are really, at this point, in the eye of the storm. And as we mentioned before, a hurricane moves, it hits you with one side of it, you go into the eye, which is calm and almost no wind or no fury. And then the other side of the storm hits you as it's moving forward. Right now, we're sitting in the eye of the storm. And this is a blessed time for us to really rush and get our act together before we're hit by the second side of the storm. What do I mean by that? I mean that we have a number of mutant viruses that are cooking. They are out there in America now and spreading like wildfire. It takes time to incubate, it takes time for them to spread, and it takes time for symptoms to develop in the population. And that's what is going on now, that time, that required time before we really see it and feel it. We have three main variants. There are the UK variant, the Brazilian, and the South African, and there are others. Again, Brother Ron will give us more information in that. But the other thing that is not very good is the rollout of the new vaccines in the African American and minority communities. The CDC just completed a study on how that rollout is coming, and it is not doing very well. It is shown that only 5.4% of the African American community have been vaccinated, and that compared to 11.4% of the white American community. So we're about half of what they received in terms of the vaccinations shot in the arm. This is not good because, as we said, we're in that lull in the storm, and this is a time for us to rush and prepare for what's coming. And that's why the getting the vaccination is so important. We also see some things that are a little disturbing. People are getting seduced by this lull in the storm, meaning that many communities are interested in rolling back the guidelines, unmasking or reducing mask mandates. And this is exactly the thing not to do. It's just the opposite. This is the time to double down, double mask, and prepare for what's coming up. Get the vaccinations that you may be having a hassle to schedule and coordinate, but this is the moment to do it. And we just want to say that we have heard that makes us feel good. So many Muslims throughout the country have reported to us that they've probably gotten their vaccinations, the first or the second, and we indeed are happy to hear this. This is important for our community, for now, for our families, and for the future. So with that, I'm gonna turn it over to our other members who will take it further, and we'll come back with any questions that you may have. Thank you.
Okay, assalamu alaikum.
Alaikum.
Well, I think where I'll start in at is to give an update on the third addition to the arsenal against this virus, and that's the approval, the EUA approval of the Johnson & Johnson vaccine. I want to talk about the launch of that. J&J has launched a new type of vaccine. It's different from the Pfizer and the Moderna vaccine. This is a vector vaccine, and it's based on DNA. And what they've done is that they have used a virus to carry a virus into the cells. A virus is very, very skilled at evading the immune system and getting into cells. So the scientists have taken advantage of that, and they have used a virus called the adenovirus. This adenosine virus is the virus that's normally associated with the common cold. And what they have done is that they have taken this virus and used it as a Uber, so to speak. And they have placed the genetic package containing the DNA of from the genome of the virus that is associated with the spike protein, and they are using this aspect to carry it into to the cell and into the nucleus of the cell. Whereas the messenger RNA vaccines that we had talked about from Pfizer and from Moderna, they did their work in the cytoplasm. Well, this goes into the nucleus of the cell, and then it unpacks its package and creates the immune response similar to the way that the messenger RNA does. But this has brought some questions up concerning some of the process that's involved in the production of this vaccine. And there's been a lot of discussion, I'm sure you've heard it in the media, of the use of fetal cell lines in the use in the production of this vaccine. Now, while there is use of fetal cell lines for the most part are immortalized cell lines. And these particular cell lines that's used in the production of this virus join company with another immortalized cell line, and that's the Henrietta Lacks cell line, which is called HeLa cells. Now, this particular cell lines, fetal cell lines, were developed years and years ago. They were developed, one was developed in 1973, the other one is 1985, and they were done in the Netherlands. And the reason why they chose these particular cell lines is because they replicate very, very easily, and they are able, scientists are able to use that in their work. Now, in fetal cell lines, they are used in two different ways. They're used for testing, and they're also used in other ways in order to gauge the effectiveness of the vaccine itself. Now, these cell lines, this fetal cell line was a stem cells from a spontaneous abortion that took place back in 1973 and 1985. It's two particular cell lines that have been used. And they use these cell lines, and they have been replicated thousands and thousands and thousands of times over the decades. So you're far removed from the original fetal cell line. And then in addition to that, the debris from these cell lines are purified out. The cell lines, any other thing that's associated with these cell lines, all that is purified out of the vaccine. And when you do take the vaccine, you're not getting any of these cell lines, these from fetal tissue. You're not getting any of that. And again, this is replication that has taken place just thousands and thousands of times over decades of use. So there's really not a factor, really not a moral factor in using these particular cell lines. And they are in use, like I said, for testing, and they are in use for other things in the production of the Johnson & Johnson. Now, also, when you're looking at the Johnson & Johnson vaccine, you have to be careful and not try to do a linear kind of apples to apples, oranges to oranges kind of evaluation, and say, well, the Pfizer and Moderna gives you 95%, 94% efficacy, and here you got the Johnson and Johnson that's got is bringing in different numbers. I think the numbers are somewhere around 72 or 84, depends on who you're asking. You can't use that kind of linear approach to evaluating, simply because during the clinical trials, when the Pfizer and the Moderna was being checked out, the circumstances were different. Now, when the Johnson and Johnson trials took place, where you had variants that had came into play, and that was in the game, so to speak, and that affected its efficacy rate, but it also revealed some information that the Johnson and Johnson had a little bit more efficacy toward one of the variants. I think it was the Brazilian variant than the Moderna or the Pfizer. Now, it really doesn't make any difference at this point what vaccine you offered. They're all, when you measure them properly, they're all running about the same as far as being effective, with the edge going to a slight edge going to the Johnson and Johnson, simply because of its bioactivity against the Brazilian variant. But now that's become a secondary issue, because they're working on boosters for 5 of the variants, but they have discovered that there's actually 7 variants in play right now. So the thing is to get the vaccine that is in front of you, and to maintain the protocols that were in place prior to Johnson and Johnson coming into the picture, which is washing your hands, masking up, and the other protocols, and using hand sanitizers and social distancing and all those sort of things, in addition to what Sister Cora has been telling us about vitamin D, the zinc, you're getting fresh air, walking, getting some exercise in. But I'll let her go in to those protocols. I think that's just about all I really have to add to what's going on with the Johnson and Johnson. Thank you. Assalamu alaikum.
Alaikum assalam. Thank you so much, Brother Ron. Bismillahir Rahmanir Rahim. Assalamu alaikum. Thank you to the mosque cares, Imam Deen, Mohammed II, Imam Adil, and Imam Imam, and all the wonderful, wonderful staff members of the mosque cares, and congratulations on the beautiful Savior's Day that we had. I guess it's about a week or so, maybe a little bit more than a week. It was really wonderful. I'm gonna go over a few things, and I'll try to keep it quick. The first thing that I wanna say is, some of you may have heard that the CDC is now recommending double masking, and it can be a little confusing. It can be a little bit confusing. So what I'm gonna do is do a very quick demonstration of the kinds of masks that are available, and if you're masking, how you should do it. Not if you're masking, but when you're if you're double masking, or how you should do it. So most of you have seen these. This is a surgical mask, and they're usually blue. They can come in yellow, white. I've seen them even in pink, but normally they're blue. These masks are really designed to keep your vapor from coming out. So these are the kind of masks that in some surgeries, not all surgeries, a lot of surgeries now they're wearing the rebreather hood so that no vapor comes out. But this is a basic surgical mask. We know that a lot of people, this should have 3 layers in it. A lot of people are using regular cloth masks. This is an example. This one only has 1 layer. These are not really that effective. no matter what mask you wear, it has to cover your nose to be effective. So you see people wearing it like this, it's useless. When they talk about double masking, they're talking about this kind of mask, either the fabric mask or the surgical mask. You can combine the two, or you can wear both. If all you have is one or the other, you can combine them. If you have both, you would put the surgical mask on first. It's more comfortable because it has this kind of fanning quality. Some of them, you can buy these little shields for the mask, the little plastic shields to keep the mask off your mouth. But if you're gonna double mask using a surgical mask, put the surgical mask on first and then the fabric mask. So I'll show you really quickly. Okay, all right, so you get a better seal because that surgical mask has that metal plate that you can put on, and then you can pull this over, seal it here. All right, now, if you're using the KN95 mask, these masks are really designed, there's some technology in them. This is kind of a new thing because really in the United States, we use N95 respirators, we call them respirators. The N95 respirator, it has to be approved by the NIOSH rather, and it molds, you can take the top and mold it to your nose. We have a version of this that we use in the hospital, but you also use them in construction. The 95 means it's designed to keep 95 of these particles, these tiny particles, out of your airway. And we, in the hospital, you have to get fitted. It's part of your annual physical, is they fit your face for them every year to make sure that the unit that you're working on has an adequate supply of the sizes that they need for all the staff. This mask is designed to fit snug. So you put on the chin first, and then the straps go over the head. And then this has to be molded very well to the face. And if there's air, the air that comes out from you exhaling should come out from the bottom. If it's coming out from the top, it's not fitted properly. And you can play with it depending on your hairstyle, whatever. Now, these are getting to be easier to get. If you're gonna combine the N95 respirator with any other mask, which is really kind of not so much necessary because this is really a very effective mask. It's not just protecting from air getting out. This has technology in it. The fabric is designed to actually kind of magnetize vapor and particles to the mask. This can be reused also as long as it's not soiled. If you do wear another mask with it, this should go on first, and the other mask, like the surgical mask, you would put, in this case, the surgical mask would go on top. So if you're using N95 respirator, this is a fitted mask. If you're gonna combine these two, this goes on first and the N95 goes on, the surgical goes on top. Most people are not finding these N95 masks. They have one called the KN95, which is, it's being produced out of the country because our N95s are being reserved mostly for healthcare workers, even though I'm seeing them now more available. I know Costco has them if you're willing to buy 100 of them, but some other suppliers now are making them more available. This is similar technology to the N95. The only thing different is the straps, and they don't fit quite as well because the straps are designed to go behind the ears. So I don't find these fitting that well, but it has great technology. And again, if you're gonna combine this mask, it has the same N95 technology. Designed, the fabric is kind of magnetized, and it's designed to keep, to attract vapor. So that's that. The other thing that I wanna say is I just wanna say something about vaccines. And I hadn't planned on saying this, but I just felt inspired to say it. I just think that we have to keep in mind that Muslims are the pioneers of education. Education, Imam Mohammed, may Allah be pleased with him, used to tell us that education is our #1 priority. And we are suffering as a society politically and our health because we have been starving for education. Muslims are the pioneers of science. Our prophet instructed us to seek knowledge and to claim knowledge. When he transitioned, the early Muslims were fired up with that, and they began collecting knowledge that had been put down in Persia, in Europe. They're the ones that revived the knowledge of the Greeks and the Romans, the valuable science that had been put down and lost. It was the Muslims who said, our mandate is to collect all this knowledge and to make it available. We're the ones that pioneered the universities. So we see Oxford and we see Harvard and MIT and Yale. If it were not for the Muslim followers of Mohammed, peace be upon him, we would not have those universities. The first university, what we would consider an elegant university system, is attributed to a Muslim woman. And we know that Baghdad, the city of Baghdad, was the place that brought together all this knowledge. The lenses that we use for microscopes and telescopes, Muslim scientists are the ones that pioneered the study of light and how to create glass to bend light. And Europeans did also, so we're not the only ones, but we have to really reclaim our history. And it's not our fault. We know that in Spain, when the Muslims were put out of Spain, they burned the libraries. They did not want their posterity thinking that the advancements that had been made were coming from outside of the Judeo-Christian world. So they physically burned libraries so that you and I would not know, and the world would not know, that we pioneered medicine, we pioneered microbiology, we pioneered astronomy. And they start off all the textbooks with Galileo and with Newton. But if it were not for our pioneering these sciences, we would not have the science of how to examine microbes. Well, Allah subhanahu wa ta'ala revealed that how would you take something from a gnat or a mosquito if it took something from you? That stimulated the Muslim mind. That's in the Quran. Allah is saying if a mosquito or a gnat took something from you, how would you reclaim that? How would you? So the Muslims are thinking, oh my goodness, there must be things smaller than a gnat. So that stimulated our minds to think about looking at small things and seeking knowledge. We have been deprived of our history, and it's not our fault, but we have to be very careful not to fall into the trap of thinking that this Western knowledge is their knowledge and natural science is the only science. There are definitely natural sciences that can help with COVID. I'm convinced that black seed and honey may be a very strong measure, but we have not done the rigorous work required to prove that. We have to collect data, we have to do research. You can't just say, well, I think black seed and honey is gonna cure COVID and just recommend it to someone, because that's irresponsible. And if people take your advice and you don't know people's health history, you don't know, you saying black seed and honey, that person might be a diabetic and can't take quantities of honey. So we have to be disciplined, we have to be responsible, and we have to know that we're in an emergency, urgent public health emergency. When you are in the middle of a war, you cannot start changing leadership. And I'm sorry for being so emotional, but I'm kind of at a phase of hyper about all of this because we've lost so many people. The last count that I started writing down the people that I know that have passed away this year is 20 people. So I just want to say that science does not belong to the European world. That a lot of that we gave them. And I want to bring your attention to one last thing about vaccines. Vaccines were originated in natural environments. The science of vaccines is farm science. The first doctor that they attribute, Dr. Jenner from England, they attribute the start of vaccines with him. However, he got his knowledge from observing what was going on the farm. Vaccine comes from the Latin word for cow, vaca. They saw that people who were exposed to cow pox, which is a version of smallpox, if the workers were around these cows that had cow pox, those workers didn't get smallpox, where everybody in the city was dying off left and right. There was nothing they could do. They didn't have the science for healing people with smallpox. People were being bled, you know, that old tradition of bleeding people, and they couldn't figure out. This doctor looked at what was going on in the farm, and he brought farm science into medical science, and he was persecuted. He was run out of the profession almost until he eventually was able to prove. We know that in Boston, in the United States, there was a slave. His name, I believe, was Onesimus, I don't know how it was pronounced, but he's the one that brought from West African science the knowledge of how to use the blood of an infected person to protect people who were infected with disease. And this doctor, I think his name was Mathis, I'm not sure. You can look it up in Wikipedia. And Isabel Wilkerson, she's the author of the book Caste. She mentions this in her book. She wrote another beautiful book called The Warmth of Other Suns. But anyway, just know that as Muslims, you know, I was communicating with a dear friend of mine, and she said, you know, I'm not too into the vaccines and so on. So I prefer to, something that she said, like trust Allah and use natural. And I remember my brother, who was a chemical engineering major, had come home one day and said, when you have the choice of using something, no, which is from Allah. I think he held like a rock, and then he showed me like a chemical formula or something, a chemical in a vial. And he said, which is from Allah? And of course, I think I was maybe 14 or 15. I was like, obviously the rock is from Allah. You know, that stuff is made by man. And he said, be clear about this. This is all from Allah. Anything that we make is from Allah, subhanahu wa ta'ala. So understand, and let's just remind ourselves that it is by Allah's permission that we have vaccine science. And yes, we have to be responsible for it and responsible for doing things ethically. But we have to be clear that this doesn't belong to any particular race. And there are things that we have contributed as Muslims and as African Americans to science that have been erased from history. And when we deny ourselves the productive use of these things, thinking that we want to be natural, I just told my son the other day, he had said something like about vaccines. And I said, because I got vaccinated the other day. And I said, I can show you in my cabinet, I have a lot of herbs, I have a lot of natural, you know, products. I do that all day. And I said, I can show you two things in this herbal cabinet that if you don't know the proportions, it will kill you. It will take you out, or it will make you very sick. So don't think that just because something is natural. Most people, back in the day, everybody was taking golden seal. You're not supposed to use golden seal more than a couple of days, and you have to know the proportion. Golden seal will create ulcers in your body, will burn a hole through your skin if you keep taking it every day. So that's that. I did take my vaccine, and I thank Allah, I only had some arm soreness. And my sister had warned me that I might be a little fatigued the next day. So I tried to really take it easy after the vaccine. I was sipping on a vitamin C liquid. And I did feel lethargic yesterday. I had the vaccine Friday. I did feel lethargic yesterday. So I just kind of took the day off and sipped on vitamin C, and now I feel like I'm back to myself. So that's it. I'm sorry for taking so long. I didn't plan on doing that, but I really felt like I wanted to just talk about some of the energy that is going around. And the last thing is ivermectin. Dr. Ramadan said he's happy about the vaccine, and I'm in total agreement with him. I'm delighted about what's going on. And also, you can read about some of the directives and the concerns that Dr. Ramadan has been bringing to our attention in the Muslim Journal every week. But there is a therapeutic, and I will put it in the chat, called ivermectin, that we've been looking at, that actually some scientists have been looking at it since October. The National Institute of Health was saying that it was not recommended for use for COVID unless it was being used for research. Doctors out of Virginia, East Virginia medical system started experimenting with it, and were finding that people did not die if they were taking ivermectin. So we know that we've seen good results with the monoclonal antibodies. That's similar to the cocktail that the former president had taken. And that's, you're kind of getting an immune boost. If you get that drug in the early stage of COVID, it is very useful to help your body fight the virus. But most people are not getting to the hospital in time to get that, especially African Americans. We tend not to go into the hospital until we're very sick, unfortunately. Those antivirals like remdesivir and monoclonal antibodies are not effective if you don't get them early. So if you feel symptoms, if you think you're sick, speak to your healthcare provider, talk to them about it early. If you find that you've missed that opportunity, ivermectin is useful in early, moderate, and severe COVID. There's research showing that it is also useful as a preventative for COVID. Does not take the place of the vaccine. And there's a strong rationale why. It's not something that you want to be taking like it's going to keep you from getting COVID, but it can be useful as an overall strategy for keeping levels of COVID down in the country. And some scientists and physicians are thinking that the vaccines in combination with ivermectin could eradicate COVID. One of the things that I like about ivermectin is it is not dependent upon, it's independent of the variants. The way it works in the bodies, even if COVID mutates, ivermectin will be useful. So it's something that we're happy to see that the NIH just recently made it more available to the doctors. Before they were telling the doctors, don't prescribe it, it's only for research. Now they're telling the doctors, it's up to you. So we expect and we hope and we pray that in the next few weeks or maybe a month or so, it will be more widely available, especially for the critical care usages. So just keep that in mind. If you know somebody that's severely ill or that even if they're in the hospital on a ventilator, even if the expectation for them living is not, their expectation is poor, ask the doctors to please try ivermectin. And our email, contactyourmhc@gmail.com. If there's any physicians or any healthcare practitioners that wants the data on ivermectin, we'd be happy to send it to you. So thank you for letting me go on so long. And that's it. Thank you.
Assalamu alaikum. This is Sister Saisa, member of Muslim Health Consortium. Thank you, Sister Coral and Dr. Ramadan and Brother Ron. Wanted to bring to your attention that there are ways to research drugs is through clinical trials. They call them phases. And it's a company that's not far from where I live in the state of Maryland that's getting ready to looking for volunteers to test what is called a nasal mist COVID vaccine. So just like with the flu, there were some experiments done on the nasal mist. There's also that for COVID now. So if you're interested in becoming a candidate in the trial phase 1. They're just beginning to they just got authorization to be able to start their trial across the country. They're looking for 180 volunteers to see if this medicine that they have come up with will work. You will not get a shot. It will be something that you will inhale to see if they can kill the COVID-19 early on before it gets into your body. It'll catch it in the nasal passages. So I just wanted to, the name of the company is Altimmune, Altimmune, working with the University of Alabama at Birmingham to create this vaccine. They're calling it AD-COVID, AD-COVID. So if you're interested in becoming a volunteer for their trials, they are looking for people to do that. Thank you.
Do we have anyone else from the Health Consortium on that wants to share any information?
Assalamu alaikum.
Alaikum assalam.
Sister Sharon, assalamu alaikum everyone from Mosque Cares and the Muslim Health Consortium. I just wanted to add the importance of not neglecting our mental health during this time. Many mental health issues that have been in the background have been actually exacerbated by staying in place in the pandemic. So in light of that, in fact, doctors are really understanding how, of course, our mental health, the stressors, being anxious, feeling isolated, actually affects our health.